Nothing beats seeing that smile on your loved one's face, especially if it shows a healthy mouth, teeth, and gums. This is why dental and oral care are very important at any age to prevent gum disease and cavities. Poor oral health can lead to a variety of systemic health issues. Gum infections are known to promote bacteria that help create fatty plaques associated with heart attacks and strokes. And in elders especially, breathing in those bacteria can lead to pneumonia. When your loved one's health is compromised, your job as a caregiver becomes much more difficult. So it's a good idea to head off oral and dental problems before they begin. A good way to do that is through daily cleaning and routine checkups. Have your loved one brush his or her teeth twice a day with a soft bristled toothbrush.
What are we doing? What's that?
It's a toothbrush. We're going to brush your teeth now, okay? Can you do that?
If help is needed with brushing, or if your loved one has memory loss, you can gently assist in the process by first placing the brush in his or her hand and guiding the brush gently towards the mouth. He or she may remember how to finish the task once you've started it. An electric toothbrush may make things easier yet and may be even better at cutting down on periodontal disease. Monitor your loved one's brushing for 2 to 5 minutes to make sure that plaque is removed. You might want to give your loved one mouthwash after brushing, but make sure it doesn't contain alcohol, which leaves the mouth dry. Instead, use alcohol-free, pH-balanced, and hydrating mouthwashes. They're recommended for elders and for those with dry mouth caused by medication. And don't forget to have your loved one floss, at least once a day, and preferably just before bedtime. In 2010, the American Dental Association published a study showing that for patients over 60, those with the highest amount of gum disease-related bacteria scored lowest on memory tests. Flossing keeps gum disease at bay, so just as you did with the toothbrush, offer your loved one the floss and see if he or she can use it without help. If not, you can do the task yourself.
Here, let me help you.
If you have trouble using string floss, a floss pick might be an easier alternative. And still another alternative is an oral irrigator, which shoots or pulses jets of water to remove debris from between the teeth. There are manual as well as electric irrigators available. If your loved one doesn't brush or floss after each meal or snack, it's important to get him or her to at least rinse. Offer a cup or bottle of water for rinsing out over a sink or emesis basin. If more help is needed, you might spray the inside of the mouth with a spray bottle, then gently clean out any remaining food with a slightly dampened Toothet oral swab. An oral irrigator can be used for this purpose as well. If your loved one has memory loss or resists good oral care, it's important that you approach him or her gently and respectfully, with patience and consideration. Find an even tone in your voice, and in the right setting, keep things routine and calm. Your attention to detail will help this process go smoothly.
Check that out. When's the last time you saw that?
Wow, a long time ago.
Sometimes listening to music or holding a beloved object will create a pleasant distraction for your loved one during those daily cleaning times. When it's time to go to the dentist, choose a professional who knows your loved one's special needs, like a geriatric dentist or one who helps out with dementia or Alzheimer's. There are dentists now who practice what's called sedation or sleep dentistry, which allows the patient full treatment while they're deeply relaxed or fully asleep through the use of pills, nitrous oxide, or general anesthesia. And with the growing number of elderly who are homebound, there are dentists that will even come to you. With mobile dental services, your loved one can get compassionate dental care, anything from x-rays to denture fittings, right at home. The rule of thumb is to see the dentist every 6 months, and more frequently if your loved one has conditions like diabetes or if he or she is not cleaning teeth on a daily basis. Rather than pulling teeth, dentists today will try to preserve them. If teeth do need to be pulled, however, your loved one's nutritional choices and overall health could be affected. Whether your loved one has real teeth or wears dentures, if he or she can't eat in the usual way or has pain when chewing, most likely he or she is not getting all the nutrients needed for optimum health. Dentures have to fit just right, or high-fiber foods like vegetables or fruit will be put aside because your loved one can't chew them comfortably. Just like real teeth, dentures can also accumulate plaque, so they should be brushed daily and should not be worn to bed. Gum tissue benefits from natural cleansing by saliva and an overnight rest from dentures. If your loved one wears dentures, he or she needs to see a dentist at least once a year to check for a correct fit. And, very important here, to get a screening for oral cancer. Older patients are in the highest risk group for oral cancer. More die of it than cervical and skin cancers combined. A screening and early detection could easily reduce the mortality rate if only people knew about it. Remind your dentist if he doesn't recommend a screening for your loved one.
Can you take that for me?
Right now?
Yes, right now.
Medications can also affect your loved one's oral health.
Take lots of water.
In older people, medications often cause xerostomia, or dry mouth, which leaves the mouth susceptible to decay and disease and can affect speech and cause throat problems. Your loved one's dentist may suggest brushing with a baking soda toothpaste, keeping the mouth moist with a saliva substitute, or using xylitol products which stimulate saliva production. So if you like to see that nice smile on your loved one's face, help it along by paying attention to his or her oral health on a regular basis. Your loved one's comfort and well-being will be enhanced, and your caregiving journey will be a happier one.